So usually when it comes to the renal pathologies, the most important ones are the glomerular diseases, and among them the two main important syndromes are the nephrotic syndrome and the nephritic syndrome. So let's begin with the nephrotic syndrome. In the nephrotic syndrome, we will begin with the first one, that is a minimal change disease. Now, this is called as the minimal change disease because if you see on an electron microscope, there is an extremely minimal change found within this particular pathology. So now if you see, there's a normal picture of the glomerular filtration membrane. So again, you can see the endothelial cells surrounding the lumen, then there is a basement membrane, and finally the podocytes. And when you see the one with the pathology, you can see clearly that the podocytes are fused or the podocytes have been effaced. This is the minimum sort of change you see in this particular disorder. That's why this is also called as the minimal change disease. Again, you can see the difference within the normal and the minimal change disease electron microscopy. Now, let's talk more about minimal change disease. So usually the most important characteristic is that you usually find this particular disease in the age group of 2 to 6 years old. This is also called as lipoid nephrosis because on a light microscopy you'll see lipid deposits in PCT. And now the second name, that is nil deposit disease. So you see nil deposits in the glomerulus if you see under an immunofluorescence. So obviously from all this we can see that the gold standard for the diagnosis of minimal change disease is our electron microscopy. Now clinically, if you see, the important point is that there is selective proteinuria and thus these respond to steroids.